Hi, everybody. Welcome to the waiting room. So I want to come on and say hi, everybody, and we are excited about all the new things that we have going on. We have launched the website. The website is thewaitingroomentertainment.com. So make sure you go there and visit. We have a lot of new information there for you to review and check out. We got some new videos on travel that is coming out. So tune into that. And then we have a lot of new resources that's going to be available on there also. And today we're actually going to be interviewing one of those. So take it away, Amy.
Hi guys. So really quickly, we have a really great special guest today from an organization that I got involved with several years ago, doing some clinical research opportunities, surveys, and such. But before we start, I just wanted to make a note that we are not medical professionals, nor do we claim to be. So if you have questions about your medical situation, you always want to refer to your doctor or your healthcare professional, because we cannot answer those questions for you. We are just supplying information and resources to help guide you in your medical journey. So with that being said, I want to welcome Molly from Saavy Cooperative. Hello, Molly.
Hi, thank you for having me.
So I want to just quickly have you introduce your organization. It's super exciting to have you here and kind of just tell us quickly how you got started with Saavy and just kind of how it led you to be involved.
Yeah, I think the first thing to share is that I'm a patient. So I was diagnosed with type 1 diabetes when I was a little kid. Grew up, my father had it as well. Fast forward, years later, about 12 years ago, I was also diagnosed with rheumatoid arthritis. And at that time, I had the pleasure, like some patients do, like you mentioned, Amy, of being asked to sort of share my voice on different, maybe it's a panel or it's working with a company. And that was wonderful. It was great. It was a part of the patient journey I didn't know was a thing. And it was wonderful. But after a while, you kind of started to see the same people at the table. And whether I went to like London or New York or Chicago, sort of the same 10 folks were always representing the millions with rheumatoid arthritis. And
Sure.
I mean, sure, it's great. You make friends, but is that really the best way to do it? And so that kind of leads me into Saavy. And so Saavy was started by two patients. So Jen Horangeff, and she is a juvenile idiopathic arthritis patient. So from infancy, and Ronnie Sharp, who's cystic fibrosis. So also patient for life. So they had a similar experience. They did something much better, started a company rather than just be talking about, not, thinking it's a good idea to have the same 10 people. They made a company. And so they started Saavy Cooperative with the idea of making sure that the same people weren't being asked, so new voices were being shared in research. But really the ultimate goal of what we do is we want patients, caregivers, to be co-creating all of the great things that companies are making for them. So that's the commercials, the auto injectors, the portals, the apps. There's always an app, whatever it
There is.
is. Yeah, we want to make sure that the patients and caregivers help co-create that, because, and it's not rocket science, if you make something with your end user, they might actually like it and buy it or use it, or my least favorite word, be compliant with taking their medication or their treatment. And so what we do at Saavy is work across all conditions. So rarest of the rare to healthy folks who might need a vaccine or maybe preventative treatment, and across the globe. So we work everywhere. Some is a little more US heavy just from market releases and the way pharmaceutical companies work. And we work with all of major pharma, digital health companies. Like I said, anyone that's making something for a patient, we want them to be involved. And so we do research ourselves. We have a great team at Saavy that can do qualitative research, where we have a platform that's accessible. So patients and caregivers, yes, you can participate in a focus group, and I'll log on to Zoom at the same time. And we do those, but we also want to include, folks that are at work, that have to put their kids to bed, that don't feel well or have treatment. And so we've built a platform that allows people to engage on that sort of community level, but when and where it's accessible for them to do. And so we do interviews and marketing mock-ups. We do things like, does this auto injector actually work for someone with rheumatoid arthritis? Can they actually use the auto injector? And one little project I can share that publicly is we worked with Amazon, for example. So they wanted their Alexa devices to work better for folks with a stutter or stammer. And so we recruited the patients, we got them connected with Amazon, made sure they were consented and paid for their time. And now everyone's Alexa. You don't have to raise your hand and say, I need help, I'm a patient. Everyone's Alexa has this patch in it that allows it to not sure what we're calling Alexa these days, allows Alexa to pause and give space and work better for someone that has a vocal impairment for whatever reason.
That's
and
amazing.
so that's just a cool example of what we get to do. But a lot of us at Saavy are patients ourselves, so we're always looking through things with that lens.
That's amazing. I mean, it's so often we find ourselves in our lives throughout the day struggling to kind of just do things that are tasks that maybe people who aren't sick don't even think about. So it's nice that Saavy kind of takes that apart and really looks at the patient experience and focuses on those maybe research opportunities that allow patients to open their pill bottles on their own and just be as independent as possible. I loved the company when I started doing stuff because it was really on my own time at my convenience. I mean, granted, some of the stuff was focus groups where you have to schedule a time and get on your Zoom or do some pre-work, but it really was me in control of saying, yes, I can do this, or no, I cannot. And you get paid for your time. And a lot of patients don't realize that that's an option for them, that they can actually get paid for their time, whether it's an actual check or a gift card for Amazon or whatever. And that's what I thought was really great about Saavy. So,
yeah, that's a non-negotiable for us. We think that the patients and caregivers, we're the experts in the room, right? And everyone else at the table is getting paid by their company, the marketing person sitting there or whoever's interviewing you. And so we don't do work that doesn't pay patients and pay them fairly. Like, it might be one thing to pay you to do an interview, like this on Zoom, but what if your face is going to be in an email or associated with a brand or a diagnosis? Like, we make sure that the pay matches the ask for the patient.
that it's appropriate. That's great. So I think when I was checking out your website, I thought it was really nice how you guys broke it down and kind of in the about section talked about who you are and your mission, which I love, which is like empowering people to use their patient experiences to improve health initiatives, which I think is great. And I liked how it kind of separated the segments about giving patients their voice back, championing inclusivity, transparency and integrity. So when you guys were kind of building, well, maybe you don't know this because you came on as the company was already built, but when you guys were sort of building the company, what was kind of like non-negotiables in terms of how you wanted to build your brand or what you wanted to do for patients?
Yeah. And so, the company was, Jen and Ronnie doing things on their own for a while, from hospital beds and from clinical trials, still just both of them doing their thing. I came on a little over 3 years ago. So right when, they kind of were like, we need some help, we can't do this anymore. And we've really grown since then. But the goal, the purpose has always been a couple things. So like we mentioned, payment, like patients and caregivers, of course, are compensated, but they're also compensated quickly. So we don't want folks waiting for us to invoice a company and their 90-day or 6-month or whatever it is to pay us. No, we pay within 24 hours. Sometimes it's within an hour. Like, that's important to us because we don't want anyone giving up their time and then not being respected on that end as well. The other thing that's really important to us is consent, understanding what you're signing up for. I know in my pre-Saavy days, I signed maybe a couple pharma contracts that I just went through all 12 pages and was like, what, because who reads that, right? Like, but that's where you then find yourself like on an email that comes in and you see your face, and somewhere in that contract you signed that you were giving up your media, your face for that. And we don't want that. So our contract is 1 page, and it's understood by the patient very clearly where any data, which is always blinded, which is always private, where that could even be going at, and what you're expected. So is this a 1-hour interview? What can you expect from us? And what are we expecting of you? Clearly laid out, very easy to understand. So those are 2 really important things to us, the payment and the consent. And then we always, just everything we do, want to have the patient and caregiver in mind. So when we don't just take on a project because someone wants to do a project. The very first thing is that project comes across my desk and like our project manager's desk to see, is this a burden to the patient community? Does this make sense? Are you asking someone, and I'm making this up, with RA to do a written survey for an hour? Because that would be horrible. That would be awful. Or are you asking them about something that this community doesn't even talk about, or like, even it's not even a burden to, they have a lot of other stuff going on. We're not going to ask them to talk about, their favorite Slurpee, or I don't know, just making something up. And so that's what I really love, is that you can't just come in and say, I want these patients, I want to do this. We have a conversation about that and say, let's talk about the best way to talk to this community. And here's what we know about this community, because we either are a patient of it, or we have, someone like yourselves or someone we know that we can turn to and ask, is this a burden to you and your community, before we move forward with anything.
Yeah, that's great. That's always something that I as a patient, I don't know how Demi feels, always want to make sure that I'm giving my time to something that I feel is going to be beneficial to my patient community, and not something that's just gonna never come to fruition, or never going to see the results of in the future. Um, I know one thing that I didn't know about your company until we kind of got into our personal talks and things, is that other organizations can kind of link together with you and create their own kind of they can kind of recruit for you guys
Like
in terms of
refer. Yep.
patients, your referral program. So did you want to kind of just give us a little
Sure.
snippet about that?
Yeah, so it's kind of like how I mentioned earlier, it's really important to us that we don't have the same people at the table. That's incredibly important to us, that we have a new voice, a new person, a new perspective, and whether that's from type of condition, or maybe it's their access to telehealth, or maybe they hate it, or whatever it is. We don't want to just bring all, if it's a gig trying to talk about people with diabetes that use telehealth, but you don't want to bring everyone that loves it and has private internet at home. We want to talk to the people that need to go to the library and they hate it and they don't like telehealth and they don't trust it, because how else are you going to build something that fits the community? And so with that being said, we lean on like our partners, like you said, for bringing new voices, because what we don't want to do is go into the safe spaces that patients create for themselves and caregivers do, like Facebook groups or support communities through their like house of worship or wherever it is, because as you guys know, as patients like me, like you share a lot in those spaces and it gets like sometimes more personal than your family. Like you share like the stuff because people get it and they understand and they know how to react. And so the last thing we want to do is barge in and say, well, here we are. Now we see all the things you talk about. Come join us, you know?
Right.
And so we want to lean on our partners to do that. And so we have a referral program, and anyone can do it, an individual patient, a group, an organization, anyone, and anyone that they refer just through their link is always linked to them. So whether they do a gig today and 1-2 years from now, whoever referred them will always get paid as well. And the real reason is, yes, it's a new face, but you've kind of given up your seat for someone else to sit in it. And we kind of believe that you should be compensated for that too. And it just seems to make sense. It's worked really well. 70% last year of our participants were brand new to Saavy in our projects. And like,
Wow.
that's awesome. Like, I think that's so cool that like 70% of people had no idea who we were or that their voice even mattered. And now they do. So I mean, I personally do love everything about Saavy, if that's not obvious, but I think the referral program is sort of easy because it's a way to like just naturally say, if you're interested, here it is. If you're not, that's fine.
And then do you find of, you know, kind of that 70% that you had that were brand new, how many like are, for lack of a better terms, like repeat offenders then and come back and do more studies on their own?
Yeah, most people do continue to do more projects because I think, like you said, Amy, we try to make it easy. We try to make it on your time. We try, again, to pay quickly. One thing I wanted to mention is the other thing that we do is we also verify that people are who they say they are. And there's a big reason for that. You know, and what I mean by that is, you know, maybe I've uploaded a picture of my portal one time and we verified that I had rheumatoid arthritis, and then that portal shot is deleted and gone. But the reason that we do that is because there are people that have learned to pretend they have an illness or learned how to answer a survey to fit into being qualified for a project to make money. It's unfortunate. We got some pretty amazing frauds at
Wow.
Saavy. We keep saying we might like make a campaign and just kind of show some of the things because some of them you're like,
I don't know anyone who would want to like pretend to be sick. Like that seems crazy to
right.
me.
And so again, that's why we verify, because yes, it's awful, but it also ruins the research for all of us. Because
Right.
if you have people that are giving fake experiences and then telling others, hey, go do this and say this and you'll get in and get your money, it ruins it for all of us, you know?
Right.
So that's why we do that. And we do that manually for thousands and thousands of patients. We just make sure they're who they say they are and they're marked and they're good. Yeah.
Yeah. I mean, I can say from personal experience that Saavy is a super easy process. You can sign up for your newsletter. It comes, I think, every Monday.
Yep.
And you basically just figure out which kind of gig or research project that you fit into, click the link, do some, you know, contact information, and then they send you a specific link that's unique to you, I believe. And also because I referred a bunch of people, or do, I have like my own little profile that I can share with other people, and then they can go to my profile and see how to set up, you know, how to get links to stuff that I've shared. Correct? Is that
Yep,
right?
exactly.
Okay.
Yeah, you can share a link for them just to make a profile, and then once they do that, they're always associated with you for referrals, and then they can, yeah, our newsletter comes out every Monday. We try to spotlight like a couple projects in there, but there's always an extensive list on our site too of all of them that are open at one time.
And
But we
then,
have new ones every day almost.
and I like too that you guys sometimes do like raffles like once a month, I
Oh
think.
yeah.
Like I forget what it is, like quality surveys or something like
Mhm.
that don't usually pay anything. You guys will give like a once a month raffle, and then sometimes I think you guys highlighted like a patient experience or something like that on the newsletter. So I thought that was really cool.
Yeah.
Yeah, so I just, as you can tell, I really love Saavy. I've been using it for a while, so I am like a full supporter. But Demi, for you, who's somebody who's been maybe not using it as long as I have, what's your experience been, or do you have any questions for Molly that
I
maybe I overlooked?
well, no, I've used it. You actually referred me, and I've been using it for at least over a year now. So I participated in different surveys myself, um, and some focus groups. I think I had one focus group, but no, I love it. I mean, I think it's awesome. I think the way that it's set up is so easy for patients to read and caregivers. It's not just for patients though. You guys do a lot of activities for caregivers too. Um, and I feel like we get our voices heard by using your guys' services to do it. And I really enjoy it a lot. Um, Also, like when it comes down to patients being able to support you guys, how are they able to support you? In other ways other than just participating in the surveys, what else do you guys, how is there, is there anything patients can do to like support you, like share your information or social media, or how can they do that?
Yeah, always welcome that. We also have it kind of falls under gigs. You'll see them pop up in there. So we have something we've started called the Ask Patients Lounge. And this has become me and a teammate's kind of baby at Saavy. So I'm very proud of it. But it started at a conference called Health, HLTH, a couple years ago. And basically we wanted to ensure that when you go to a conference, right, everyone's talking about what they've done for patients and talking about patients. And we thought, well, what if you all actually talked with them too? And so we started back in 2022 bringing patients. And so we set up the first year was sort of a genius bar. Like if you go to the Apple store and like they help you, well, the patients were the geniuses and people could come schedule time to chat about anything. We wanted to normalize patients are people. We're people. We go to conferences too. We cook, we live, right? But also you can just talk to us. There's always a fear, especially in some different, professions. Oh, I can't talk to a patient. I'm not allowed. I can't do this. You can, it's okay. We've made it okay. And so that really blossomed into that we are at a lot more conferences now, but we need patients to come with us. And so we always, there's calls out right now for, I think one that's in Amsterdam. We just came from one in, where was I? Los Angeles, trying to
Yeah.
remember. We'll be back at Vegas. We were in Orlando, kind of all over the place, but we want to again stick to our mission, bring new patients each time. And we make sure that, and it is caregivers too, I should say, I should catch myself, patients and caregivers. And we want to make sure we have a diverse representation that comes. So people that don't all have the same condition and don't all have the same experiences. Maybe someone is rural and they have to drive 4 hours to see their specialist, and maybe someone has the privilege like I do of having Johns Hopkins down the street. What does that look like for folks? And so we make it really easy. We've been lucky to partner with conferences that give us like a cool lounge bistro kind of setup where a patient and has someone come join them. They can book a 20-minute live chat and talk about anything. And people have told us that 20 minutes with a patient was the best part of any conference they've been to. And they had never known the value of that. And so we love the patients coming with us. And I think the other side of that is the feedback I've gotten from our patients that come is that they left feeling like rock stars. And it's like, but you did the work. Like you the one that sat there and attended. And so always looking for new folks, of course, for our gigs, but also for that, it's a fun experience. We also do it via tele, so we can be accessible and include people that can't travel, because that is very much our motto, but it should be everyone's. In person is hard and it's a privilege to travel in person, and we don't forget that. But yeah, we would love for folks to share that. But the other thing, and we kind of chatted about this before, is send us the great things you're doing. We aren't a community resource for conditions because we work in all of them, and all jokes aside, we'd be horrible at it. We would be horrible trying to maintain all of these resources and all of these events and all of these great communities. And so we lean on folks like Demi and Amy and anyone to send us the things you're doing. Tell us the stuff that you want other patients and caregivers to know about or to see, or be proud of the cool things that you've done. I had a great woman I chatted with who started her first 5K in her little community. And I was like, send me the article, like, let's share it. And so I would love for folks to take us up on that and just, and yes, you can share us, but share yourself with us. I guess I kind of reversed it.
Right. That's amazing. I think that's so cool that you guys, you know, a lot of times, like you said, people are really afraid to ask patients about their experiences, but I feel like if we sign up for something or we're out there, all we're waiting for is somebody to just ask us about our experience because we're willing to share if we're in that atmosphere where, you know, we're ready to and accept that we want to talk about it. So I think that's really
Yeah.
great. That's great.
Yeah, so that we'd love to take anybody if people want to. We have an open sort of application on there. I think it's like our speakers one, but it's meant to just be a, would you like to come talk?
Yeah.
So you don't have
Yeah.
to be a professional speaker. Please don't feel like anyone has to do that. Your lived experience, I always say this, that's all the prep you need. You've done
Right.
it all. You've lived it, unfortunately. And now, like, let's have some good come out of it, you know?
Yeah, that's great. Okay, so quickly, well, not quickly, but at your own pace. If I'm just a regular patient, a new patient, and I see Saavy on social media and I want to get involved, how would I do that? Where would I go? What's the website? Walk me
Yep.
through that.
So easiest website is Saavy, SAVVY .coop, COOP. Now you can link out to there to all of our gigs, all of our projects. You can, you know, link out to our social media. But I also want to give our email too, which is just as easy. Community@savvy.coop or Molly@savvy.coop. You can please email me. I know from a lot of patients, you know, it's rightly so that cautious in signing up for things or even Googling is dangerous at this point, right? Like things that can pop up. So feel free to email. I'm always happy to even jump on a call and just show that we're real, show that we're real patients too. Like if that makes someone more comfortable, the calendar is open, always happy. And plus I clearly love talking to people, but yeah, visiting us on our website is great. That'll link out to our different pages and all of our projects. And again, those are updated as soon as a new one comes through. And if you do make your profile, like you both have shared that you did, and you have your conditions noted, we can alert you too if there's a project that comes through that could be a fit for you. So we can also do that, so you don't feel like you have to keep checking for a new one. It'll auto let you know if there's one that's a fit.
That's great. And
Cool.
so we'll put all that at the bottom, right, Demi, of this
Okay.
video. So we'll have
Yeah.
your website, your email, and a little, you know, how to kind of get in touch with you guys and be a part of Saavy if the patients are willing to.
You want to put your referral link too? Make sure that
Yeah,
that's
that's what I was
there.
going to tell Amy is that
Yeah.
that would be awesome. We would so guys, we have decided to partner with Saavy. So on our website, you can go to our website under the More tab and you will see a link for Saavy there with a blurb about more information on them. And also underneath this video in the description, we'll make sure that you have Molly's email and all the information on Saavy underneath here too, so that you can get signed up and start participating. I really enjoy what you guys do. I think it's so awesome. And hopefully soon we'll be having Saavy at some of the waiting room entertainment events, so that you can actually sign up in person. So,
Awesome.
and get to meet them in person. And you guys know already, we have 2 annual events. One is in Columbus, Ohio, and one is in Las Vegas, Nevada. So those are going to be 2 events that are again being done this year. Rare Disease Day just ended, and we did have the Columbus event already, but we will still be having the Vegas event. The date is to be announced. So Amy.
Yeah, so thank you so much, Molly, for your time, for all the great information. I just can't say enough great things about your company. And thank you for being here. And we'll see you guys next time on the Waiting Room YouTube channel. And make sure you like and subscribe. And thanks, guys.
Bye, everybody.
Thanks for having